Call the member for Higgins.
Thank you, Mr Deputy Speaker. And I rise to contest the opposition's statement that the government has failed to adequately prepare the aged care sector for the COVID-19 outbreaks. There really could be nothing further from the truth, and I'm not sure whether those opposite have actually been to visit the aged care sector in their own electorate, because I certainly have. And I have worked tirelessly in the last few weeks and months to work with my aged care facilities to ensure that they are prepared. So it is almost an insult, actually, to hear what is happening from the other side. It is a cheap shot, and that is because it is a very fragile system. We know that. We know that there are difficulties in the aged care sector, and that is why there is a Royal Commission. But with regards to COVID, it is a very special pandemic that is happening, a very special virus that has done something extraordinary. Unlike every other respiratory pandemic that we have ever seen, it has a predilection for the elderly. There is no other respiratory pandemic that has ever done this anywhere in the world. Every other pandemic, whether it's the Spanish flu or any other, has affected the extremes of age, both the very young and the very old. So this pandemic is unprecedented for many reasons, but one of the most unfortunate aspects about this pandemic is its predilection for the old. Now, we know this because we have seen it unfold overseas. We've seen the carnage overseas, the carnage of those dying in aged care homes at much significantly raised rates than here compared to Australia. Now, we know this because if you look at our per capita rates of mortality in our aged care sector, it's 0.17%. That is 15 times lower than Canada. That is 30 times lower than Italy and Ireland, and 53 times lower than the UK. So if you want evidence of what would happen if we didn't have a plan, just go overseas. And I have spoken to many of my colleagues on a regular basis about how distressing it has been because the governments, like the UK government and the US government, haven't had a plan. They haven't had a plan to deal with the health crisis that has approached the country. They haven't had an adequate plan to deal with those in aged care. We, on this side, have had a federal government that has been on the front foot from the very start. And I'm enormously proud of what we have done and what we have achieved and what we continue to achieve. And as someone who's been in public health for most of my research career, I understand how hard it is to prove that prevention works. But right here in Australia, you can see that a plan prevents deaths. And I'm very proud of what the Minister of Health and the Minister for Aged Care have actually achieved. And it started back in January. We all could see what was happening in Italy, with deaths happening. I had colleagues calling me from Italy saying, please, please don't let happen in Australia what's happening in Italy. Medical researchers and medical practitioners in Australia were also contacting me and telling me that people were dying, dropping like flies in Italy. That has not happened in Australia, and that's because we put a plan in place. So to say there was no plan is absolute insult. To start with, in January, we preemptively acted with the first of 6 stages of a national plan for aged care prevention of COVID. It even has plan in the title, and it committed $100 million to aged care sector preparedness. Then, in February, we then developed the Aged Care COVID Response Guidelines by the Communicable Diseases Network of Australia, and that was ratified by the AHPPC, which is the Australian Health Protection Committee, which is made up of all the chief health officers of the states and territories. And these were using the world's best practice guidelines, including recommendations from the US CDC and from the WHO. And then in March, we committed $440 million for funding to support the aged care workforce continuity, which included a retention bonus, because we understood that these aged care facilities needed to be ready. They needed to be ready because we understood as a government that this COVID pandemic, if it gets out of control and there is community transmission, it ravages the community, it ravages the aged care sector. So we were prepared. But unfortunately, what happened is the Victorian government let the team down. We had widespread community transmission, and it was actually the workers who took it into the aged care sector. But I'd like to give a shout out to the aged care sector because they have been doing it tough. It's not been easy, and we should be proud of how they have prevented thousands of deaths here in Australia, and I'd like to thank them from the bottom of my heart. Thank you.